Good day, my name is Louise Villaseñor from Villaseñor. For this video, I'll be performing a return demonstration regarding the essential newborn care. For the assessment, first you're going to have to prepare for the delivery. You're going to have to assess for perineal bulging with the presenting part visible. This is the second stage of labor. Second, you're going to have to check the temperature of the delivery room. The temperature should be within the range of 25 to 28 degrees Celsius. The air should be free of air drafts, and you have to notify the appropriate staff. For the very first step of our implementation, we're going to perform proper hand washing. After performing hand hygiene, we will now proceed to putting on our gloves using the double gloving technique. So within the first 30 seconds, we're going to perform the immediate and thorough drying of the newborn. So first, we're going to call out the time of birth, and then we're going to do a rapid assessment while thoroughly cleaning the newborn. So we're going to have to assess the eyes, the face, the head, the front and the back, the arms and the legs. Okay, Miss Donna, so I'm going to have you to push. Okay, 1, 2, 3, push! 1, 2, 3, push! Baby girl out, 9:30 p.m. After thoroughly drying the baby, now we're going to initiate early skin-to-skin contact. So we're going to remove this linen. Then we're going to put the baby in prone position on the mother's chest. We're going to cover her with another blanket. Then we're going to put a bonnet on her head. And an identification band on her ankle. Now, we're going to do a properly timed cord clamping. So first, we're going to remove this first set of gloves. Then we're going to put on new sets of gloves. Putting on the third pair of gloves, now we're going to let the cord to stop pulsation on its own without milking it. When it stops pulsating, we're going to clamp 2 centimeters near the base of the umbilicus using this plastic cord clamp. And then we can proceed to put a second clamp 5 centimeters near the base of the umbilicus. Then we're going to get our scissors and cut near the plastic clamp. So within 90 minutes, we're going to perform the non-separation of the newborn from the mother to perform early breastfeeding. So we're going to have to inject 10 units of oxytocin into the mother's arm intramuscularly and while leaving the baby in his skin-to-skin contact with the mother. Miss Donna, so sasaksakan lang po kayo ng oxytocin, okay? Hinga pong malalim. Okay na po. Now we're going to have to observe for any feeding cues from the newborn. Feeding cues includes the licking, tonguing of the newborn, and if this happens, we're going to have to point this out to the mother to encourage her to nudge the newborn towards her chest. Then we're going to check for the congenital malformations during this time as well. So, Miss Donna, kapag ka po si baby is dumidila na, pabumuka na po yung bibig niya, maaari nyo na po siyang i-breastfeed. Kapag ka po ganon, ilalapit nyo na po siya dun sa may nipple ninyo at para po makapag-ready na siya, okay? So, Miss Donna, tulungan ko lang po kayo kapag ka ganon, maaari nyo po siyang hawakan ng pagganito. Yan. Para po makapag-ready po siya ng mabuti, okay? After doing so, we will now check for the mother's condition at the perineum area to check if there are any bleeding or tears. So, Miss Donna, check po natin sa may perineum area ninyo kung meron pong pagdurugo o kapag ka po merong tears, okay? Okay, Miss Donna, wala naman pong problema. After ensuring that the mother is in an excellent condition, we can now deliver the placenta. Examination, eye care, injections, weighing, and bathing of the baby should be performed after the first full breastfeeding. We should do these things after the newborn has detached from her mother's nipple. We're now going to perform eye care, administer the vaccination, washing of the newborn should be postponed until at least 6 hours.
For the evaluation and documentation, you're going to have to evaluate the newborn. You're going to perform the Apgar scoring as well as the Ballard and Silverman-Anderson scoring test. Then you're going to document your findings.
That is all for my video. Thank you for watching.